Hey guys, I think I'm back up here. I was so excited. I didn't plug in my microphone. My microphone's sitting here with no plug. And I'm like, all right, getting messages that there's no audio. I was just so freaking excited that I just forgot it was even plugged in. So I goofed. Apologize for that. We've been hitting up some questions here on Facebook, and because they're connected to my iPhone, so they're not connected to my computer. I had to do a little restart action. So glad we're back here. We'll continue to riff it. So I'll give it a minute here for some questions to come in on YouTube. Another question here on Facebook. Molybdenum is in a lot of liver products and nutritional blends. It gives me migraines the last 4 days. Why is that? Hard to say. Number one, it could be a detoxification effect. It could be just you're pushing detoxification pathways and some of those toxins are coming out, right? There's always that aspect too. Number two, it could be a sensitivity issue. So I would also potentially look at just decreasing the dose. I would really just drive that dose down, go super, super low, and see if you can tolerate it then. If you still can't tolerate the molybdenum, I would make sure that you try some other things like the vitamin C, like the activated charcoal, like some fibers. I think those things are easy to tolerate, and you can just start low, work your way up. Also, ginger tea is nice because ginger is anti-inflammatory. It's an anticoagulant, meaning it prevents things from sticking together. So when you get inflamed, like cells tend to stick and clot, right? You tend to get inflamed, a lot of lymphatic congestion, right? So keeping things moving, keep that sludge moving is a great way to help on the detoxification side. Which infections can cause ketoacidosis, if they can at all? Infections can't cause ketoacidosis, maybe unless it's a major issue that like it's like like some kind of like amoebiasis that creates some kind of hepatic liver like cyst that disrupts liver function. Because unless it'd have to really shut down your liver for that to happen. Liver is important for blood sugar regulation, but the major reason why you're going to have ketoacidosis is primarily you're type 1 diabetic and you don't have insulin, and ketones go so high that they become acidotic and it drops your pH and screws up your enzymatic systems and you go into a coma. Or number two, you're an alcoholic and you have severe liver cirrhosis, and that liver cirrhosis is basically just decreasing your liver function, and then that's a big component for blood sugar regulation, and that throws that off. But like I was saying, maybe an infection that really disrupts the liver. That'd be the only thing I could think of. Suggestions for adrenal fatigue. Again, that's a broad topic. Done lots of podcasts and videos on that. I would suggest go check out those videos. But number one, anti-inflammatory diet. Eating every 5 hours, or 4 to 5 hours, I would say. Healthy proteins and fats every meal, and then a protocol specific to what your adrenal pattern shows. But check out those podcasts and videos. Please give your thoughts on ASEA water and Restore supplements. I think Restore, that's Zach Bush's product. They're both redox signaling, but would taking them cause an uncoupling effect of natural processes? Don't know enough about Zach Bush's product. I've heard good things about it, from it helping the leaky gut function. Again, let's say it does help the leaky gut function. Let's say it does help those tight junctions and helps leaky gut, which then helps the immune system. The question would be, well, is the root cause of the leaky gut addressed? If you're eating grains and gluten and you take Zach Bush's Restore product, will that fix it? No. If you have underlying infections that are still present, will that affect it? No. If you have stress that's out of control or poor digestion or low stomach acid or enzymes, will that fix it? No. So I look at supplements that are palliative that will help support healing, but you can't ignore the root cause. The root cause still has to be addressed while you're doing something that's palliative and supportive. It's like using curcumin for, inflammation in your back. Great, that will help. But are you sitting all day? Are you doing any exercise? Are you seeing a chiropractor or a massage therapist to make sure the joints and the soft tissue is working better? Okay, you are great. Then the curcumin's palliative. It's going to support it. But if you're just doing the curcumin by itself, then no, it won't fix the root cause. Let's see. I'll keep on hitting these questions up for you guys. I got doctors today report my testosterone levels are 5.1. I'm 22. Yeah, that's a weird reference range. And that may be free testosterone. You're using kilograms, so I'm imagining that maybe you're European. 44 kilograms, I think that's 100 pounds. So that's pretty small, pretty lean individual there. I need some reference ranges. If you can give me some reference ranges, that'd be helpful. But yeah, if you have severe malabsorption, then that makes sense. 100 pounds sounds pretty malabsorbed, especially if you're a guy for sure, female. definitely on the lower side there. And again, a lot of the nutrients to make healthy testosterones and to come from fat soluble vitamins, cholesterol, zinc, selenium, magnesium. So if you're not able to break down those nutrients, then you're going to have a hard time making it on your own. Keep on hitting it up here. Are you going to swab today for the baby's microbiome transfer before the mom's C-section? Absolutely. We are going to do that. That won't be done till Monday, right before the C-section. And again, my wife has to have a C-section. We had to have a fibroid removed about a year and a half ago. It was about the size of a baby's head. It was just too big. And, you know, she was right around 39, 40. And that her fertility window is a lot shorter at 39 or 40. And to knock out a fibroid that big may take 4 or 5 years. I mean, there's some work with with specific enzyme therapies using serrapeptidase at high doses. You could potentially knock that down, but my wife had used birth control pills throughout her 20s and late teens, and that may have thrown her into a state of estrogen dominance, which caused that breeding ground for the fibroid. Just the question is, when the fibroid's that big, you know, it's going to take years to knock that thing down naturally. It was just easier to have it removed than it was done. And then basically we got pregnant 1 month later because the fibroid was just sucking up all that blood. So yeah, we will do a vaginal swab. And again, with her situation, no OB or midwife would allow a natural delivery just because of the slight increased chance of uterine rupture, which would kill her and the baby. So not good. So we got to go that way. Even though I'm a natural guy and I'd rather do it, you know, the old fashioned way, we got to do what's best for the mom and baby. Something feels tight all the time. What could be the cause? Well, first thing first is making sure you're able to digest your food. So simple thing is stomach acid and enzymes to make sure you're breaking down your food. And even before that, eat in an environment that's going to be stress-free. Lots of nose breathing. Don't breathe through the chest, breathe through the nose and the bottom and the belly. And make sure you have a good stress-free environment and chew your food well, at least 1 chew per tooth. So 32 chews. Again, you don't got to be anal about it, but if you're chewing about 30 times, your food should be like an oatmeal-like consistency, almost liquid. How to detoxify the liver? That's a pretty broad question. I would refer you to other podcasts and videos on that topic. But again, sulfur, amino acids, antioxidants, B vitamins, and a lot of the nutrients that are in green cruciferous vegetables like indole 3-carbinol, sulfur compounds, diindole methane. All these are great. My 50-year-old very healthy husband is having a hip replacement. Doctor wants him on Coumadin and Celebrex prior to the surgery. Any better suggestions? A lot of times they don't want people on blood thinners prior to surgery. I mean, like a lot of docs, they'll say, yeah, don't take fish oil, don't take enzymes, don't take ginkgo. They'll try to, you know, avoid the blood thinners. Maybe your husband has a history of heart attack or pulmonary or vascular issues. Not quite sure about the history, so I can't speak specifically to him. Celebrex is going to be an anti-inflammatory. I think it's a COX-2 inhibitor, so it's a pain medication. Coumadin's obviously a blood thinner. So typically, if you're going to try to thin the blood, I always would do it with fish oil and enzymes, and also reducing inflammation. That's the best way to thin the blood. But again, if you have to do it for the surgery just because your surgeon won't operate on you, or it's just kind of their policy, you know, you do it for whatever time frame you can, and then you get back onto the natural stuff afterwards. And again, you know, if you're having a hip replacement, I always say get to the root cause. Putting a prosthetic hip in there does not change the fact that your hip is not absorbing force properly, or there's malnutrition and basically producing a joint with poor integrity. So get the collagen peptides up, get the gluten up, get the inflammation down, see a good chiropractor that will do muscle testing, apply kinesiology, and ideally some bioelectrical therapy like ARP therapy to get the surrounding musculature working well. I'm going to have a biohealth hormone panel. How many days before I take the sample should I be off identical hormone therapy and Vitex? If you're doing Vitex, you can probably stay on that. It takes weeks to kind of get into your system, and it's not going to skew the test that much. You will see a nice bump in progesterone, but I would stay on the Vitex. And if you're doing drops, you should be off the drops 2 to 3 days before. And if it's pills or creams, about 1 week before. Any way to increase testosterone naturally? 50-year-old testosterone just measured 663 from conventional doc. Not bad. Not bad, James. 663 is not bad at all. I'd be curious to see what your free testosterone is. 663 is like right in the middle of the reference range. The reference range is probably from like 350 to 900. So you're kind of right in the middle there. That's pretty good. Lifting weights, of course, resistance training is obviously going to be one of the best. Getting good sleep is going to be excellent. Getting enough protein, so if you're trying to really increase it, I would try to get at least 0.5 to 1 gram per pound of body weight. So, I'm 210 pounds. So I try to get I get about 3/4 to 1. So I try to get about 150 to 170 grams of protein per day, and then keep the insulin under control, right? If you're not exercising, keep insulin really low. And then if you exercise, then post-workout, you can get a little bit more carbs in there to blunt the cortisol and increase the HGH. How long to heal a hyperthyroid through your protocol on average? That's really tough to say because there's a lot of aspects of thyroid issues. So number one, the major cause of thyroid issues are autoimmunity. So if you're having autoimmunity, and let's say it's been going on for 10, 20 years, your immune system may have beaten the crap out of your thyroid so bad that your thyroid can't really produce thyroid hormone. All the little follicles have been attacked and burst, and you're going to need some level of thyroid therapy, like hormone replacement, forever. So we always start with the least amount of hormone, natural hormone possible to get you at a healthy functional range. That would be 3 or above for T3 free, 100 or above for T3 total, typically T4 1 or 1 to 1.5, T4 free 1 to 1.5, T4 total 6 to 10. That's, getting your TSH closer to 1's a pretty good litmus test, but then you got to fix the other stuff, right? A lot of people will start feeling worse going on thyroid hormone if their adrenals aren't supported. And then you got to fix the leaky gut. So if there's gluten sensitivity, low stomach acid, low enzymes, infections, all those have to be addressed. But I would say 6 months to a year is a pretty good rule of thumb there. Should I take or use progesterone to balance my high estrogen? So again, if your estrogen's just high from a ratio perspective, that would work for sure. You want to fix the underlying stressors that are causing your progesterone to get low, because progesterone goes low for a reason. It's typically because of stress, emotional, physical, or chemical stressors. Number two, fixing the adrenals is important because the adrenals will produce a good chunk of progesterone too. And then if there's any gut or other issues, getting that dialed in as well. What's your take on smart drugs like the racetams? Now Dave Asprey takes them. Are there any long-term effects? Again, piracetam has a lot of studies on it. A lot of good safety studies. I'm okay with piracetam. It's a water-soluble smart drug. Got it in that GABA family. And then if you look at some of the other ones like modafinil or Provigil, these drugs are other drugs that work on the dopamine side. And then you have like aniracetam or oxiracetam. Those have a little less safety studies on them. Piracetam more. Again, go listen to my podcast with Dr. Andrew Hill. We talk a lot about smart drugs in that podcast. But again, I'm a big fan of smart drugs for punctuated specific situations. You're cramming for a test, you're going to a conference, you got to be on for a certain amount of time, right? For punctuated situations, I'm not a big fan of it for like everyday stressors. For everyday stressors, I'd rather use mitochondrial nutrients. I'd rather use B vitamins. I'd rather use adaptogenic herbs. I'd rather use things like PQQ. I'd rather just use things to up my ketones, like medium chain triglycerides and such. So I like those, or just amino acids to boost up dopamine, which is really important for focus. I'd rather do those things long-term and save the smart drugs for punctuated situations. Let's see here, no prior health issues, prior to hip surgery, anatomically, ball to socket, ball to big for socket, got it. It's been seeing myofascial therapy for 1 year, good. Lots good. Excellent. So yeah, so there may be an anatomical issue that needs to be addressed then, but I would still look at making sure the other muscles in and around the hip are strong, like really good integrity with the hip flexors. A lot of people, their hip flexors are so tight and it creates a shearing force, making sure the glute med, the glute max, the TFL, and the rectus femoris, all these muscles around that hip girdle are working properly to make sure that hip is stabilized. A lot of people post hip surgery, when I was doing that work, I would come and test all their muscles and it'd all be off. And it's like, okay, great. You're going to need it replaced in 10 years then, or the other hip will be next in line. I fast 18 hours a day. Should I not take any supplements in the morning? Again, I would, depends. I would take the nutrition in the morning. If you're taking some B vitamins and fish oil and those kind of things, I think you're okay. Those are micronutrients, right? The whole idea of the fast is primarily a macronutrient based fast. And a lot of times when you're IFing, it's more the protein you're trying to fast from. and the carbs, right? Because those are the ones that can stimulate the insulin. Fat tends to be a little bit more neutral. Collagen tends to be a little bit more neutral out of all of the amino acids. And I wouldn't be doing IF personally every day. I like it for punctuated situations once or twice a week to pump it up. Women with severe histamine intolerance report it goes away when they get pregnant, and then it returns after giving birth. What would be the logic besides progesterone going up? So yeah, progesterone goes up via HCG from the placenta. Number two, there's a shift in the immune system. So there's a shift from TH2 to TH1. TH2 side of the immune system is the humoral branch, and that tends to drive allergies. TH1 is the cytotoxic immune system. That's more for like the invaders, the natural killer cells, the helper cells. So it's probably the shift in immune system balance from TH2 to TH1. Do you have digestive support products, HCl combo? How much before each meal to increase? Yep. I have Digest Synergy is a good one. It's got some pancreatin. It's got a lot of hydrochloric acid in there. That's a good one. Typically 1 to 5 is a pretty good place to go. Start low, work your way up. People that have more digestive issues, I separate the HCl and enzymes out just so you can pump up the enzymes. If you can't tolerate much HCl, you can at least jack the enzymes up and keep the HCl low. Monica, astragalus or ashwagandha, 2 different herbs. Astragalus I'm going to use more for immune modulation. Ashwagandha I'm going to use for more stress, sleep, and adrenal modulation. 2 different ones, but astragalus is great. Mono, infections, getting sick, love it for that. Dr. J, is this the right order? Detox, inflammation, gut repair, correct hormone imbalances, remove infections, restore gut flora? No, it's not the correct order. The correct flora is going to be nutrition, right? Nutrition and lifestyle. That means blood sugar stability, anti-inflammatory, nutrient-dense, low-toxin diet, sleep, hydration. That's first. Second's going to be hormones, adrenals, thyroid, female or male hormones. 2 is going to be removing infections, and then and getting the gut fixed. And then part 3 will be detox and nutrition, extra nutrients on top of that. And again, when we deal with the gut stuff, 6 R's, remove bad foods, replace enzymes, acids, repair gut lining, adrenals. 4, remove infections. 5, repopulate probiotics, even if it's transient, right? 6, retest, make sure the infections are gone. How do you reintroduce eggs if someone has intolerance to them? Well, get off them for a bit, fix the gut, fix the digestion, remove infections, and start with just egg yolk soft. Then introduce, a lightly cooked full egg, keeping it soft. Don't do scrambled. Poach is a great way to do it because you get a capacitor on the heat. Can't get hotter than 212 degrees Fahrenheit, right? A frying pan can get 300 to 400 degrees Fahrenheit if you're just frying it. So doing the poach, you keep the temperature at 212, flash it for 30 seconds, pull it out. You can start off by trimming away the whites and then just having the yolk soft, and then you can try introducing the white. Just stay away from the scramble to begin with because that can oxidize some of the protein and cholesterol. Thanks for your feedback, Monica. I appreciate it. How do you diagnose and treat gastritis? I had no gas or symptoms, but ultrasound show a lot of abdominal gases. Again, you got to fix the root cause. So you got to start with just stress in your life that will turn on the sympathetic nervous system and shut digestion off. 2, chew your food really well, right? 3, avoid hydration during foods. 5, increase stomach acid and enzymes. Okay. 6, get rid of the infections, right? Which will help with the leaky gut. Probiotics to follow. Thoughts to protect my son from getting a concussion while playing soccer, and what to do immediately if I suspect he has suffered from one. So a couple things. Number 1, you can do basically calorie restriction for 2 days afterward. It's shown to be very neuroprotective. It can help some of the inflammatory proteins that are produced to be essentially recycled. Number 2, you can do antioxidants like resveratrol and curcumin. And then number 3, you can do progesterone. You can do progesterone afterwards. I think it's 50 to 100 milligrams a day is very neuroprotective as well. Again, I wouldn't recommend it for a boy, but if it's because of a concussion and a neurological issue, then I would do it for that, for a few days afterwards. And then number 2, you can do hyperbaric oxygen chamber therapy. You could also do low-level laser therapy over the head as well. Okay, so here, how is ZRT thyroid essential kit compared to a conventional Dox thyroid test? The ZRT thyroid kit is going to be a finger prick test. I only do that one if people are limited. I like to order a Quest or a LabCorp one where they're actually getting a blood draw, but I only do that one if it's we're limited and there's not a lab nearby. But yeah, again, it's going to be okay. Theranos did blood spot tests like it. There was some inaccuracy with them, but it's kind of like my last resort if people don't have access to a lab. But you got to just use the functional ranges. For detox, I have a kit from Heal. Not sure you know about it. Chlorella. Yeah, I do like Heal. They have a homeopathic kit that I've used in the past, and I think it's really great. It's got some lymphatic stuff in there. Very good. Let's see here. Bernardo says, 32-year-old male, blood cortisol in the mid-range, 16.8. Saliva cortisol, mid to low range. Prolactin's almost 2 times the upper limit, 26 to 30. Adrenals are not responding as they should. Yeah, so when you have prolactin high, it's typically because you're burning up a lot of your adrenaline, right? Dopamine can be made into adrenaline. Dopamine's a tonic inhibitor of prolactin. So think of prolactin as when dopamine drops, when dopamine and adrenaline drop, prolactin does this, okay? So the more stressed you are, the more you're taking your dopamine and your adrenaline and you're pulling it over here, and that's going to take the brake off of prolactin and allow it to rise up. So you got to support the adrenals, you got to support the dopamine and adrenaline neurotransmitters, and you got to fix whatever that stress is. If it's some emotional stuff or if it's sleep stuff or if it's internal stuff, you got to get the root cause fixed. Okay, is creatine a good thing for supplementing for increasing mitochondrial health? Yep, I think it's great. Use buffer creatine, 10 grams post-workout. Pre-workout's great. Permanent dizziness and cervical pain. I have adrenal fatigue, mitochondrial dysfunction. Do you think these are related? What could address the dizziness? Again, it would depend. I need to do a history, but if there's any trauma at all, physical trauma, there could be. I want to know where the timing of it is. So seeing a good chiropractor that addresses the upper cervical spine is great. I would also see a good myofascial release therapist or an active release chiropractor that can work on any adhesions in the muscles in and around that area. And I would also, you get the adrenals worked on too and cut out gluten or grains in general. Candace says, loving the Q&As. Also loving how to interpret your blood test video. Please do more of those. Awesome. Thanks, Candace. All right. You missed my previous when I detox 2 months. I do the detox kit from Heal, Loma chlorella, milk thistle, ALA, and alfalfa before meals. Anything else you recommend? Yeah, it's pretty good. If you look in my line, I use Liver Supreme and Detox Aminos. So it's going to have the milk thistle in there. It's going to have some of those things in there. The only thing I'd say you're missing is you're missing the sulfur amino acids. So if you look at my Detox Aminos, you can kind of see what's in that. If you go to my site, justinhealth.com, and click on the Healthy Living store and then click on Detox, you'll see that. Thanks so much. I'm considering traveling to the USA to have a consult with you. Thanks for your great work. You're welcome, Bernardo. I'm also available via Skype and phone, so you don't have to even travel to see me. You can just jump on Skype and connect. Actually, I'm already a little bit late for a patient here. Hold on, I got a couple questions on Facebook. How beneficial is coconut for the gut? Very helpful. Really good medium chain fatty acid. Excellent. Best time to take BCAAs. You can do it pre and or during the workout. You can do it post-workout too. Stuff's darn nasty as heck, so I recommend doing it pre and just getting it down. Not health related. Do you work with international patients? Yes, I do. I work with them basically all over the world via Skype and phone. I've gotten 2 sex hormone pellets in the past, but I wanted something more natural. I can't tell if it's worn off. I'm having hot flashes. Got it. So yeah, you really got to get to the root cause there of that. So if you're a menopausal female, we got to fix the adrenals, and we probably have to support your hormones bioidentically. It's going to be good. What are your top vitamin C products? Buffered vitamin C with various vitamin C minerals in there, like potassium ascorbate or magnesium ascorbate. These are all great, and or bioflavonoids like hesperidin or rutin. These things are great too. Again, I have one called Vitamin C Synergy in my store that I like very much. Testosterone 105, estrogen 303, insulin 6.6, 32, 160. Yeah, insulin looks okay. Maybe a tiny bit high. It could be a touch bit lower. Testosterone, I would need some reference ranges on some of those hormones to give you more specific feedback. All right, here. And then for sulfur amino acids, kind of simply take MSM. That's okay. You could do MSM, but I'd recommend the other ones too, because you make glutathione from cysteine, glutamine, and glycine. So you want to have those in there for sure. All right, guys, I got to jump on to a patient call here. It's been real. You guys have a great week, and I will try to be back here next week. All right, take care, YouTube.